Let's start things off by talking about the two different processes that occur in the heart, because they involve slightly different cardiac action potentials, which we're going to talk about next. So the two main processes are conduction and contraction. The conduction system uses specialized cardiac myocytes in the myocardium called pacemaker cells. These pacemaker cells have the capability of generating their own spontaneous action potentials. These specialized pacemaker cells are located primarily in the SA node and AV node, but they can also be found in other areas of the conduction system, including the bundle of His, the right and left bundle branches, and the Purkinje fibers. As mentioned before, the pacemaker cells have the capability of generating their own spontaneous action potentials. The SA node, which sits in the back of the right atrium near the entranceway of the superior vena cava, has a faster inherent pacemaker rate than the rest of the pacemaker cells. So in a normal functioning heart, it's the SA node that creates the initial electrical impulse that travels through the conduction system, ultimately leading to cardiac contraction. If the SA node is suppressed, then the other pacemaker cells can kick in to generate that initial electrical impulse. Once the SA node has generated that spontaneous action potential, it will depolarize the right and left atrium. The electrical impulse will reach the left atrium through Bachmann's bundle. This atrial depolarization will lead to atrial contraction, which will push the blood into the right and left ventricle. The electrical impulse produced by the SA node will then reach the AV node, which sits in the base of the right atrium. Conduction velocity is slowed through the AV node just enough to allow for filling time into the right and left ventricle before those ventricles contract. The electrical impulse will then travel through the bundle of His, followed by the right and left bundle branches. The right bundle branch will depolarize the right ventricle, the left bundle branch will depolarize the left ventricle. The electrical impulse will then terminate in the Purkinje fibers, which further depolarize the ventricles. This ventricular depolarization will lead to ventricular contraction. So now we have a good understanding of the conduction system and the pacemaker cells involved. Well, contraction is going to use non-pacemaker cardiac myocytes. These myocytes make up the bulk of the myocardium and include the atrial and ventricular myocytes. Well, these non-pacemaker cells do not have the capability of generating spontaneous action potentials. They rely on external stimuli to depolarize, and when they depolarize, this is ultimately going to lead to contraction, not conduction. Let's now talk about the action potentials between the non-pacemaker cells, including the atrial and ventricular myocytes that lead to contraction, versus the pacemaker cells, including the SA node and AV node that lead to conduction. Starting with the atrial and ventricular myocytes that lead to contraction, all you need to remember is summit, plummet, continue, plummet. You don't even realize it yet, but you have just learned everything you need to know about this action potential and the ions involved. So here's how it works. We're going to first draw out the action potential. So first we're going to summit, then we're going to plummet, then we're going to continue, then we're going to plummet. When these atrial and ventricular myocytes are at rest, the voltage across their cell membrane is approximately minus 90 millivolts. Now we said that these are non-pacemaker cells, meaning they cannot generate their own spontaneous action potentials, so they rely on external stimuli from either the conduction cells or surrounding cardiac myocytes becoming depolarized. These stimuli will make the cell slightly more positive, and when it meets a threshold of approximately minus 70 millivolts, this will generate an action potential. The first phase after generating an action potential is the summit phase. Now what ion is going to be involved in the summit phase? Here's where the catchphrase comes into play. Summit starts with the letter S, so it's going to be sodium that's involved. And if the cell is becoming more positive, is sodium going to be entering the cell or exiting the cell? It's going to be entering the cell. And that's exactly what occurs during phase 0 of the action potential. When the voltage across the cell membrane meets that threshold of minus 70 millivolts, this will open sodium ion channels, leading to an influx of sodium into the cell. This will make the cell more positive, and this is referred to as depolarization. The next phase of the action potential is the plummet phase. Well, what ion is going to be involved during the plummet phase? Let's use that catchphrase again. Plummet starts with the letter P, so it's going to be potassium that's involved. And if the cell is becoming more negative, is potassium going to be entering the cell or exiting the cell? It's going to be exiting the cell. And that's exactly what occurs during phase 1 of the action potential. The cell is now positive enough that the sodium ion channels close, reducing the influx of sodium into the cell, and potassium ion channels are open, leading to an efflux of potassium out of the cell. This will make the cell more negative, resulting in a slight repolarization of the cell. The next phase of the action potential is the continue phase. This is where the action potential is plateaued. So if we have potassium exiting the cell, this means we have to have a positive ion entering the cell to counteract this and keep the action potential level. So what ion is going to be involved? Let's use the catchphrase again, and continue starts with the letter C, so it's going to be calcium involved. This is phase 2 of the action potential, in which calcium ion channels are open, leading to an influx of calcium into the cell, while there's an efflux of potassium out of the cell, keeping that action potential at a level state. Now we know whenever calcium enters a muscle cell, this will lead to contraction, and this is exactly what occurs during phase 2, in which the atrial and ventricular myocytes are contracting. The next phase of the action potential is another plummet phase. We know from the previous plummet phase that it's going to be potassium involved, because plummet and potassium both start with the letter P. And if the cell is becoming more negative, is potassium going to be entering or exiting the cell? It's going to be exiting the cell just like the previous plummet phase, and that's exactly what occurs during phase 3 of the action potential. The calcium ion channels have now closed themselves off, reducing the influx of calcium into the cell, but the potassium ion channels are still open, resulting in an efflux of potassium out of the cell. This will lead to the cell becoming more negative, which is referred to as repolarization. The final phase of the action potential is phase 4. This is when the cell has repolarized back to its resting membrane potential of approximately minus 90 millivolts. This is when the atrial or ventricular myocytes are in a resting phase and they're relaxed. This is diastole of the heart, and they're waiting until another external stimuli occurs to generate an action potential which will lead to contraction again. Let's now compare this action potential to the action potential of pacemaker cells, including the SA node and AV node. This action potential is a little bit easier. All you have to remember is climb and plummet. So first you're going to climb, then you're going to plummet. The reason for this is they're conduction cells. They aren't contraction cells, so there is no need for any phase 1 or phase 2 because they don't contract. All they need to do is depolarize and repolarize over and over again to create those electrical impulses that will ultimately lead to contraction of the non-pacemaker cells. As we said before, the pacemaker cells have the capability of generating their own spontaneous action potentials, so they don't rely on external stimuli. The voltage across their cell membrane slowly becomes positive on its own until the threshold voltage is met, creating an action potential. The first phase of the action potential is the climb phase. Well, using the catchphrase, what ion is going to be involved? Climb starts with C, so it's going to be calcium that's involved. And if the cell is becoming more positive, is calcium going to be entering the cell or exiting the cell? It's going to be entering the cell, and that's exactly what occurs during phase 0 of the pacemaker action potential. When the voltage across the cell membrane meets its threshold voltage, it's going to open calcium ion channels, leading to an influx of calcium into the cell, which will make the cell more positive and depolarize it. Then we move on to the plummet phase. The plummet phase of pacemaker cells is very similar to that of non-pacemaker cells. We know that plummet starts with P, so it's going to involve potassium. And again, if the cell is becoming more negative and plummeting, is potassium moving in the cell or out of the cell? It's going to be exiting the cell. And that's exactly what occurs during phase 3 of the pacemaker cells. The calcium ion channels have now closed themselves off, reducing the influx of calcium, and potassium ion channels are open, leading to an efflux of potassium. This is going to make the cell more negative, resulting in repolarization. The next phase of the action potential of pacemaker cells is phase 4, and as mentioned before, they don't have a true resting phase. They don't rely on external stimuli to generate an action potential. Rather, that phase 4 slowly becomes more positive until that threshold voltage is met and another action potential is generated.